Very good. Yes. Okay. Bismillahirrahmanirrahim. Yes, my dear student, my friends, my colleagues, my brothers and sisters. Can you hear me? Yes. Okay, so today, from now to another 15 or 20 minutes, we'll just review my technical session 1, 2, 3, 4. Okay, so drug design and development, the art of science. Okay, last I'm going to very quickly. Yes, and drug discovery of development timeline. Okay, so why drug discovery or drug development research is needed in like third world countries or Asian countries or OIC countries? Because I told many times, patients are different. Patients are different. Okay, okay, our medicine is the same. Okay, so you see, a group of people, if 100 people are giving same medicine, but their diagnosis is different. It may work, it may not work. Patient is different. Our physiology is different. Same medicine, it may work someone, but that same medicine, it may harm someone. Okay. So patient and drug discovery, it's a lengthy process. It's a long time. It takes billions of rupees. So initially, so what happens? So we need some idea. Okay, idea, some imagination power. So if some plant using for traditionally for some kind of diseases, so that means in it something is there inside. Very simple. Something is there, therefore it is active. So what is something? So this is the active ingredient of a molecule that is working. Okay, as you know, in enzyme. Okay, so you see in your family or anywhere, many people is there. Okay, but only 1 or 2 people is working. Mostly, remaining people in your family, maybe your father is incoming. Okay, but your other people are depending on him or her. Right? Same is true for the chemical, a family, one master molecule or mastermind. Okay, or master people. Same is true in the plant materials or anywhere. There are thousands of compounds. Thousands of compounds. Out of 1,000 compounds, many things is unnecessary. Many things is not necessary, but it is needed. It is needed. Okay, it is needed to protect the master molecule. So, if you find 10,000 people got many compounds, thousands of compounds, this compound first you have to take it, either they have toxic effect or not. Okay, toxic effect or not. Number 2 is either any activity or not. Okay, now what you do, so if you target a disease, okay, so diabetes. So what kind of drug is working there? One is alpha glucosidase inhibitor, insulin secretagogue, insulin sensitizer. This kind of drug is there. So this kind of drug has some characteristic features. Okay. Normally, if you got 10,000 compounds, billions of compounds, which is compound bank, by doing computational chemistry, so doing computational chemistry, you can search. So these millions of compounds, our chemistry colleagues are doing this. So millions of compounds. Okay, there is a compound bank or compound library. Let's check it. What kind of compound has this kind of ability? By searching it from millions, they got thousands. Then make it another short unit. Then they give more cut point. That means I need this pizza. Okay. Ultimately, what happens? This compound bind to the receptor or some molecules, like so. Their interaction, hydrophobic interaction, van der Waals. In this way, they make some scoring. In this scoring, finally, from say 100,000, they got 40,000. In this 40,000 compound, they again shut down. Okay, I could make a narrowness. Finally, it got mostly 10,000 compounds. And even this 10,000 compound, so in the laboratory scale, in the academic purposes, very difficult. Okay, then again they make it narrowness. Sometimes do the computational chemistry to get a minimum number of compound. This compound tested, we are giving some formula, some command to the computer, but this activity, in silico activity. Okay, we find this compound has this kind of activity, Now we tested this compound for a wet laboratory. Either it is in silico data and in laboratory data, mass or not mass. If it is massed, so out of many compounds, so if you say we are testing 20,000 compound, chance is 20%. Okay, so even 20% compound, say we are giving 2,000 compound, maybe out of 20,000, 200 or 100 or any number of compound is following is well massed with the in vitro and in silico. Those are give result in silico as well as in vitro. Here with this compound, we make a score. Okay, some are partially massed, some are well massed, some are moderate massed. So we make the compound mild, moderate, and potent. Right. First, we want work on potent compound. Those are very active, very potent. With this compound, we do toxicity tests. Either they have toxic or not. Okay. So if the toxic, we don't work anymore. Those are non-toxic. So we are getting 100 compound or 50 compound, right? This non-toxic compound, now it's the time to work on it. You got 50 compound. Now the question is, you are getting 50 compound here. 50 compound for testing in animal model, preclinical studies. So for preclinical, for in vitro studies, for in test tube or appendix tube or in 96 cell folate. As I told you, its volume is 300 microliters. Okay, that means less amount of compound is needed. For animal experimentation, that is mice or rat, you need more amount of compound. Then you have to think critically. So you want to work on compound. This compound is available or not available. If it is available at your lab, and you have to calculate the quantity, or you have to check it either it is commercially available or not. If it is not novel compound, it is commercially available or not. If commercially available, then you have to check the price of the compound. Sometimes 10 milligram compound cost is almost, let's say, 1 lakh rupees, 2 lakh rupees. So you have to consider many things. You are getting very good compound. It is not available in the lab or not available in the market. Available in the lab, quantity is very less. Available in the market, price is too high. Then you have to nothing to do. Okay, you We have nothing to do because we have some financial constraint. We cannot do all the things. Anyway, in the large of a compound, some you will get few compounds, 2, 3, 4, 5. That is either it is available in the lab or available in the market. Okay. Now somehow the compound in your hand. Now with this compound, what you do? You do animal experimentation. You do this. So you do preclinical test. Preclinical test. What you do first, you have to do the toxicity, acute toxicity. Either these animals are toxic or not toxic. Toxic or not toxic. First, what you do, if you have to give some doses, okay, doses to the mice or rat, and then observe its behavior. Observe its behavior. If it behave well, maybe what we do after 24 hours, after 7 days, after 15 days, we sacrifice the rat. Collect the blood, and collect different tissues. We collect the liver, we collect kidney, major tissues collected. Then what we do? We do hematology, we do biochemical test, either it is toxic. If it is toxic, normally we routinely do liver function test and kidney function test. This is very common. So this liver function test and kidney function test, we take it, and in the meantime, we also see if liver function test and kidney function test, it is nothing wrong, well and good. If something is wrong, then you have to go histology, either it is tissue, what happened in the tissue. Okay, so if it is not toxic, well and good, then the compound will work on it in the real activity. We give the compound in the control rat, and we give the compound in the model disease rat. So control rat as well as diabetes rat or diabetes mice. Okay, then for diabetes, it is blood glucose. What we do? We do acute check. We give the compound and measure the blood glucose after 1 hour, 2 hour, 3 hour. Either before going to the master experiment, we want to see what is the dose. Either in many compound, we give it the compound after 1 hour, 2 hour, 3 hour. Any tendency to decrease, either it is blood glucose state or blood glucose, it is little bit decreasing tendency. If in whose dose, it shows some decreasing tendency. So the compound A, B, C, D, E, F, G. So we say we got compound C and D has a decreasing tendency, right? Then compound C and D, we make 3 or 4 doses. Whose dose gives maximum effect, maximum tendency? So one by one we do. We got compound C and D. Someone work in 5 milligram per kg, and someone working in 1 milligram per kg. This dose, what we do? These doses, then we give the experimental rat, disease rat, for long time. Normally we do 1 month. Okay, 1 month or 42 days. Okay, either 4 week or 6 week. Okay, 6 week, because 6 week we do in such a case that we can measure in the HbA1c. You know HbA1c, glycated hemoglobin. Blood glucose is changes every second. Blood glucose is changes every minute. But in human, what is the lifespan of the RBC? 120 days. 120 days. What about the lifespan of RBC in rat or mice? Any idea? It's less than 120 days, not 120 days. It 30 to 40 days. Okay. So lifespan of RBC in mice or rat, normally we work in rat, it is 40 days. For safe side, we can, so that we can blood glucose as well as we can monitor the HbA1c. We do 30 days or 42 days. Okay. After giving every day, we're giving the doses. Please remember, my friends. So you are giving the compound to the control rat. Okay, the compound is dissolved with some water or somewhere, like somehow. Okay, so one control group, many people do mistake here. The control group, that means untreated diabetes. So many people, untreated diabetes means they don't give, if it's untreated diabetes, so group A, untreated diabetes, group B, C, D, those say group 1, 2, 3, 4, right? Group 1 is the untreated diabetes. Group 2, 3, 4 is the treatment group. So group 1, untreated. Group 2 is 1 milligram per kg. Group 3, 2.5 milligram per kg. Group 3, 5 milligram per kg. Group 2, 3, 4 will give the dose. What will happen in group 1? Will give something. Will give anything or nothing. Will give anything or nothing. Group 1, control group, control. All in the solvent. Okay, normally in human, as I told you, we give the capsule, you can placebo. Active ingredient is not there. Okay, because you are giving the in the experimental animal, okay, some doses you are giving either orally or somewhere in animal in stress. But the same stress should be done through the control animal. Okay, so if you don't do this, your experiment is not valid. Okay, so in the control group, we call it untreated diabetes or untreated group. You have to don't dissolve the compound. Without the compound, the same volume you have to give it. And so in my lab, okay, normally per kg body weight, right? We are giving per kg body weight. So make your compound in calculation in such that if you don't know, so I can give some tips and tricks. Normally what we do, we dissolve the compound in such a way that if it is the rat is 200 gram, will give 200 microliters. Okay, if it is 250 gram, 250, it's accurate, but sometimes it's not possible. Okay, sometimes it's not possible, but it is also possible. Normally we give, okay, give calculation is milligram per kg body weight. So make a simple calculation. Jitna weight hai, utne microliter. Make your life very easy. Okay. Giving after 28 days, 42 days, we are giving some results. Okay. After getting results, so some compound, say found compound A, B, C, D, E, compound C, what your compound C and D, you find compound C is working, compound D is not working. Okay. This compound C, it goes to clinical trial. Human, no toxicity, at least some data. Okay, normally, if you do one species, normally for the MPhil thesis, it's one species enough. For PhD thesis, you have recommend at least you have to do 2 species. For the drug discovery, you have to do, if it is mice and rat, then you have to do another higher species like monkey, donkey, like this. Okay, so after those, it goes to clinical trial. Clinical trial, as I told you, clinical trial, right? So in clinical trial, so normally what we do, clinical trial, phase 1, phase 2, phase 3 clinical trial. In phase 1 clinical trial, the drug is given to the healthy volunteer, healthy subjects, healthy volunteer, so that we want to measure it, either it is safe or not safe. We measure toxicity and how much the drug they can tolerate it. In phase 1, control subjects, a small number of subjects. First, we want to say it either drug safety and tolerability. And phase 2, it is a big difference. Phase 1 and phase 2. Phase 2 is the patients. Phase 2 is the patients. And this is a single center. Okay, small number of patients. It is a small number of patients, and it is single blind experiment. That means patient don't know either he's taking a placebo or medicine, but you know it, either green capsule or red capsule. Okay, nothing is written there, but you know it. Green means control, red means drug, or it may be reverse. Okay, or दोनों है ना, both of the same color, both of the same color. So in the both of the same color, everything is same. At certain point, there is minor changes. You cannot see it. Is a mark is there. Who is giving? He can understand the marking. Okay, so that patient is not confusing. So someone like you are giving red, doctor साहब मुझे green चाहिए. ठीक है, ऐसे भी patient है. Okay, then same color, minor changes. Top of the tip, something is there and something is not there. Okay, giving placebo and drug, phase 1, phase 2. Then phase 3, same study we tried doing, as I told you, patients are different. But phase 3 will do the same study with multiple multi-center, multi-country, number will be increases. It is normally, you know, statistical analysis. You have some idea, t-test, and you have an idea, t-test. Yes. T-test depends on two things. It compare mean value to mean value, right? And as well as it compare number of subject to number of subject. If it is small number of subject, value is mean value is okay. So 10 subject in control, 10 subject in diabetes. You say here the control is in control 80. Diabetes value is 95, right? It is not significant, but it is 80, 95. Subject number is 100, 100. Mean value is the same, but subject is the number is the difference. It makes, if it is mean value is the same, it makes difference, statistical difference. That means it is the number game. More the number, okay, no more the number. So statistical significance depends on the sample size as well as mean value. Okay, that means if you got more number, 10 times, 20 times number, it will be more authentic, more reliable. In this way, and this type 3 phase 3 clinical trial was done multi-center and double blind. No one knows it. Only agent is not. Okay, and agent is not. So it comes to the market going well, but sometimes everything life is not always butter and sugars. Sometimes sadness, badness, life like ups and downs. Same is true the drug discovery. So, or if everything going well and good. If not, then you have to withdraw. This is the short. So this is the short story of short story. In between, there is many things: pharmacokinetics, pharmacodynamics. Many things have to do. But this is the short story of drug discovery and drug design. So from molecule to market, it may survive a long time, but it may not survive for a long time. It can withdraw for any time due to it is post-survival market. Because as I told you, patients are different. Maybe some patients they tested in somewhere, it is okay, but it is in other side of the country or other many countries, the patients are different, their physiology is different, the genetic pharmacogenomics is different. That is not working. Not working, it's okay, but it is toxic. Sometimes it causes death. Then very dangerous. And if you claim it, and then FDA make it investigation, then make it many studies. 40% drugs would do from the market. 40% drugs would do from the market. So this is the short study of drug discovery. Okay. So now we'll study or we'll listen. So histology part, how histology make a role in drug discovery. How histology make a role in drug discovery. Yes, brother. Can someone ask about IT person? IT person. IT person. So I'll change my slide within this 1 or 2 minutes. So here, this is the summary of my previous lectures. Okay, drug design and development. So in pharmacokinetics, it means what our body will do with drug, right? We're taking the drug, and what is the effect of our body to the drug? Pharmacodynamics is the what drug do to our body. Okay, in pharmacokinetics, absorption, metabolism, distribution, metabolism, and excretion. In absorption, it's absorbed first, they distribute it all over the body. Then it is, if action is done, Please, IT person. Please. So one code. So pharmacokinetics, absorption, distribution, metabolism, and excretion. If it is one, it should be eliminated from our body. Okay. For elimination, you need metabolism. Metabolism, why needed? It is needed to make insoluble drug to soluble drug. Okay, this is the main purpose of drug. So, and drug, either it is it's a 31. So pharmacokinetics and pharmacodynamics. In direct pharmacokinetics, what is the effect of concentration with time? And pharmacodynamics, so effect of concentration or the efficacy and potency. So either this drug is effective or not effective. Okay. So if it is effective, there is some range, therapeutic range. In some ranges, the drug works. We call it therapeutic range. So below the range, we call it subtherapeutic range. It is no good. And above that range, we call it toxic range. Okay. So normally, nowadays, people are living long. People are living long with some disease. So initially, our average lifespan is 50 years. So people die without many complications or any complication. But now, life expectancy is 70, 80, 90, 100s. Okay. So nothing to do. After 60, you have to do many diseases. You have to survive with disease. There is no way. That means you have to take medicine. You have to take medicine, right time, so that you can manage your therapeutic range. So never ever. So if you want to go anywhere, if you are in medication, your father take home message for you. Smartness I learned from Japan. Okay. So normally I was in 5 years in Japan. So one thing I found very interesting. So they don't make iron of their clothes. They don't make iron. We are very much doing iron. Normally, I found this very interesting to me. Okay, so interesting to me. So they focus on their work. The people only that very top position, because pressing one iron, it costs 1,000 rupees. Quite expensive. So they have different way how we can wear clothes without ironing. So I was 5 years, I never ever did an ironing. I don't know. If it is there, very expensive. So they think. So you are working. If you do work the best way, it is smartness. Smartness not is the sharp pen ironing. It is not there, not the smartness. Normally, I found, because time is money, they believe this one. Normally, if we took the 10 or bus, we open the pocket, put money back, 10 rupees, they give it. They know I'm going to Islamabad, this one. Bus fare is 10 rupees or 14 rupees. They will take exactly 14 rupees. It makes your life easy, make their life easy. Okay. And the ticket, they pass the ticket, they don't put pocket, they put it here. transit and going there. Normally, I found in my real life example, someone from Bangladesh came, they go there, station very rush, he open her bag, उसके बाद छोटा small bag, ढूंढा नहीं मिला, okay, so then time is money. I found they put a ticket here, so I'm going there, they make their life easier. Yes, madam, don't, okay, I found, okay, there is a story, one story here. So bus है ना, bus, you are doing bus in the last time, madam, किराया चाहिए, rent चाहिए, open bag, इसका नीचे और एक bag, in the conductor is going outside. Again, conductor came, okay, the whole road goes. So please be smart. Keep your ticket with you, okay, save your time and make your life easy. Make your life easy as their life easy. So this is smartness. The work done in a smart way, it is the smartness. To post a photograph in Facebook, it is not a smartness. Okay, it is not smartness. Okay, be smart. Okay, develop yourself. This is smartness. Do your work, perfect works. It is smartness. Do timely. There is in Pakistan, we call it 9. 9 means 9:20, 9:30. In Japan, 9:00:00 means 9 0 minute 0 second. Because every 30 seconds there is another train. Okay, they use second. Therefore, they develop time. Okay, time. So, my dear brothers and sisters, so this workshop, at least the the pharmacokinetics and pharmacodynamics, right? In pharmacokinetics and therapeutic range. Now it is your own duty or responsibility to take good medicine at the right time. Number one, and take care of your elders. Take care of your family for the drug, taking the drug. So that your father, mother, elder one, take right drug, so that always in the therapeutic range. Even they go somewhere, give the medicine first. Either medicine, give the medicine first. And sufficient amount of medicine. I found many, my father-in-law, mother-in-law went to Australia, and after 3 months or 1 month, okay, make a phone call that this medicine is not yet, please send this medicine. Yeah, embarrassing situation. We have to start, who will go to Australia? This medicine is not available here. So medicine, okay, medicine, take care. This is the most important. Okay. So now I come to this point, the historical techniques for drug research. So this is the summary of histological technique. Okay, one of my students, he did PhD, it is his thesis. Okay, this is rat, right? Histology. This is rat. We are giving anesthesia. We're dissecting. Okay, dissecting this tissue. We took the tissue and we're making sectioning this tissue. Sectioning the tissue, then making slide, making slide, and then we do either histology or immunohistochemistry. Okay, so what is histology? Okay, so there is some website. So we like this website very much. One is the General Histology Protocol. In this website, everything is written very carefully. Number one. Number two, I like this website I like this website. The pathology guy, we call it path guy. Okay, they have hundreds of cells. How to know the cells in many tissues? What kind of cell is there? What kind of, initially they get a tutorial. 1, 2, 3, 4, 5, 6, the idea. Then there's an MCQ. Either you are able to not. So any disease or many disease, this is the best. Okay, to learn how to do pathology, how to learn the cell, how to recognize the cell. And another is histology protocol. This is a few. This is the few website. Okay. Now the histology. Histo means tissue. Cyto means cell. Logy means study. Histology, very simple. Histology. Okay. Meaning of branches of it's called histotechnology. Major step in technology is fixation and fixative, tissue fixation, tissue sectioning, paraffin oics, types of microtome, staining type and cleaning solution. Normally, what we do here, we see my student this one. So after dissecting, okay, you are getting tissue. You are getting tissue, and with the tissue, it is solid tissue. Then what you will do? You have to fix it. Okay. So what is the beauty of histology? What is the beauty of histology? That means many techniques there. Histology, you can see it. So what is the beauty of histology? So if you do Western blotting, biochemical test with tissue, okay, biochemical test with the Western blotting, you will collect the tissue. Then what will you do? Tissue? No, no. Western blotting is this space for Elijah. We first make tissue homogeneous. We first make the tissue. We give a buffer. We give tissue, say 1 milligram tissue, 10 ml buffer. We make it homogeneous, right? We make it solution. That means first thing we do in biochemical test, we destroy the tissue architecture. First thing we do, we destroy the tissue architecture. In histology, first thing we do, we preserve the tissue architecture. Got it? So in biochemistry, one question, one answer. Either this kind of protein present or not. In histology, one question, many answers. It is present or not? Yes, no. If it is present, where is located? Either it is in nucleus or cytoplasm. If it is nucleus, it is the center or periphery. If it is cytoplasm, it is the near to nucleus or near to cell membrane or in between or near to Golgi apparatus. It gives many answers. You got my question? So I told you one story. So there is a king and there is a minister. Okay, the minister was very smoothly, perfectly. Okay, sometimes the minister's wife, sort of he graduated from somewhere. And his wife, right? King wife, he thinks his brother to be a minister. Then he requests his husband, so is it possible to make my brother as a minister? Home minister, wife, बात तो सुनना ही पड़ेगा. तो ठीक है. So next few days later, he did okay. Check one thing. So go this village. I have in this village there is a dog and he gives some bird, some baby. Can you check how many baby of dogs? He went there, come back. He asked how many puppies of the dog? It will be 11. Then he asked how many boys and how many girls? I don't know. Again he goes there. Then he asks how many boys and how many girls? 5 boys, 6 girls. How many black and how many white? I don't know. Again he went there. Okay, then he said, okay, 4 white and 4 black. 4 white, 4 black. What about evening 3? Again he went there. Okay, then that means he went 1, 2, 3, 4, 5 times, right? Then he asked the minister. So I heard there is some dog is there, his baby is there, can you check it? He went there, he took notes. 11, male 5, female 6, 4 black, 4 white, 1 maroon, this. He asked, okay. Then the king answered his wife. So this is the boy I am paying for him. It seems easy, but not easy. But one single question, many answers. Okay, one is minister. Okay, so this is the beauty of histology. One single question, many answers. And number 2, one thing is seeing is believing. Remember these things. So during I give always this example, the marriage. During marriage, you are giving 100 biodata. 100 biodata. Biodata के साथ biodata है ना, और 1 pages, 2 pages, 3 pages, like, and 1 photograph. First photograph sheet, only 1 second, 2 seconds. If it is like this, biodata जरूरत नहीं है. That means One single photograph replaces 100 pages. One single photograph replaces 100 pages. Seeing is believing. Remember this thing. So the beauty of histology is you can see it. You can see it is far, far better. Imagine. Seeing is believing. So this is the beauty of histology. Okay. So this tissue, we take it, we fixed it because we have to preserve the tissue architecture, right? So for this histology, the microscopic histology, normal histology, and histology and histopathology. Pathology means section or tissue of disease condition, right? Histochemistry. On histochemistry means if it is the chemistry. Chemistry means antigen antibody. We call it sometimes immunohistochemistry. Or it is immunocytochemistry. If it is tissue, immunohistochemistry. Or if it is cell, immunocytochemistry. So we have to first fix it. Fix it. There's many fixity. Fixation, dehydration, cleaning, embedding, microtomy, this one. We have to give little what is fixative. Fixative is chemical substance that fix the tissue. Okay, normally we used formalin, and we use 10% buffered formalin. If it is formalin is not here, sometimes 70% alcohol is enough. Okay, so 70% alcohol, we make the tissue, fix it. Okay, and normally the thermal rule is, so if tissue is 1 milligram, then fixative solution is needed at least 10 to 20 volume. Okay, and depends on the tissue. If it is soft tissue, it takes short time for fixation. If it is a hard tissue, it takes long time for fixation. Sometimes our fixation is bad. And in fixative, normally it depends many things. One is temperature. If you do room temperature, sometimes some tissue work good in room temperature, sometimes 37 degree, sometimes 42 degree. But normally room temperature is normally room people do it normally. We did. Okay. So one is fixation done, it is preserve the tissue architecture. Okay, right. Then what we'll do, so 10 to 2 times of more volume, the temperature has been more important. As I told you, temperature, lower temperature and higher temperature. Higher temperature will decrease the fixation but increase the autolysis. Sometimes if higher temperature, you are getting shorten the time, but it destroys the tissue. In higher temperature, sometimes autolysis. Okay, normally people now why people do 37 degree, 44 degree? Because our पास time नहीं. Initially, people have time. Okay, people have time. People come so good. Okay, you have to purchase the clothes, go to the dorji, stitch करेगा 2-3 दिन लगेगा. अभी नहीं, market जाओ. So the time we have now, everybody want to do quick. Everybody want to quick, especially the supervisor. They need quick result. Okay, the Chinese student they can do very quickly. Without doing experiment, they can make results sometimes. Okay, fixation by heat, fixation by chemicals. Normally you do chemicals. And there is many kind of fixative. Normally 10% buffer formalin, normally our routine procedure, our tips, this is study enough. Okay, but those for histology it's okay. But those you want to do immunohistochemistry or immunocytochemistry, they actually need some special care. We are not going on this. Many fixatives there, special fixative, secondary fixative, primary fixative, many. Then they go 10% formal saline, 10% neutral buffer formalin. These are we using this one. Okay. And sometimes we use for immunohistochemistry, hemocytochemistry, bovine fixative, it picric acid. Okay. This kind of picric acid fixative in case of
नॉर्मल सलाइन की सर वो कितने परसेंट होती है जरा बैक साइड पे जरा
10%.
10%.
10% buffer formalin.
All right.
Normally formalin it is available market is 40%.
40% formalin, I guess.
40%. Okay, you need to make with the cheese buffer. Okay, cheese buffer. I'll show it. Okay. Okay. So once tissue is fixated, then the tissue you have to do sectioning, right? Sectioning you cannot do it. For therefore you put the tissue where in some X. We call it paraffin. Okay. If it goes normally paraffin, okay, little by little we put tissue in paraffin, in liquid paraffin for overnight. So if it is liquid paraffin, then what we do, this liquid paraffin we put with some mold. Okay, mold it means we put some paraffin, then put the tissue there. Okay, then again put tissue, put paraffin and put in some places it solidify, and this called tissue block. Okay, so the beauty of paraffin and beauty of tissue block, the biochemical test, if you make tissue homogeneate, yes sir, if you make tissue homogeneate, if you put in 4 degree, you can work maximum 1 month. If you put in minus 20 degrees, you can work maximum 3 months. If you put, yes sir, can you sit here or there? Yes. Thank you. Yes, madam. Now you can see it. So the beauty, so biochemical test, you make tissue homogeneate, you have to store in the either 4 degree or minus 20 or minus 18, right? So it is 4 degree, you can work maximum 1 month. If it is minus 20 degree, 3 months, minus 80 degree, 1 year, 2 year. Okay. Theoretically, but reality in tissue homogeneate, I work on it. Tissue homogeneate, there is many enzymes. Always there is some enzyme working. So always it make degradation. Always make degradation. It's big problem, tissue degradation. Okay. But the beauty of this histology, okay, and the biochemical test very from laboratory to laboratory. But histology, once you make the paraffin block, if the paraffin block, it will stay for 100 years. 100 years. And if you make the section, if you do staining, you can put room temperature, it will stay also 100 years. You can carry that. So sometimes in Aga Khan, they preserve their slide 1 or 2 years. If you go somewhere for cancer diagnosis, if you need, they will give that your slide. You can go anywhere in the world, they can check either it is okay or not. This is the beauty. So it gives the tissue architecture, and for long time.
So what is the ideal thickness of the tissue?
There is no ideal thickness. It depends on you. What kind of work on it? If you do histology, normal staining, so 8 micrometer. 8 micrometer. Okay, or 5 micrometer. Okay. Right? But immunohistochemistry is more thinner, more better result. Because if you cut any slice of cucumber, okay, you make more slice. That means if you make one slice, it makes one part. But if it's too thick, that means there is 2 levels. One is top, one is up. Top, one bottom. So that means more thinner, more better. But normally for histology, immunohistochemistry, 5 micrometer section give better result. Okay, normally histology 5 to 8, immunohistochemistry 3 to 5. For other things, for the Electron microscopy, you need nanometer. Yes, sir. Anything?
What is the lowest possible gauging or grading on this microphone?
Okay, so I work with microtom, similar this microtom. We can use 3 micro. Okay. So depending on it's more thinner the section, the microtom is more expensive. Okay, microtom is expensive. It is not the factor. Factor is there is some blade, a knife. So okay, there is some knife, and if you make thinner section, you have to purchase diamond knife. Very expensive. Many things have to, but our cases we did, we did. So my expert is on histology, immunohistochemistry. So in our case, we found the normal life 3 micrometers is fine. Okay, but it takes human can do better way. It's dissectioning little by little. Yeah? You need smooth, you cool brain, cool mind. Yeah? This way, one section coming. Yeah? So female can do it better because you can make roti, very well. Same. 3 is fine. So the paraffin section we do in microtom cut here, right? But there is we call wood crash here. Fixation is not needed. Fixation is not needed. What you do during the patients, those are in, especially in hospital. Okay, so someone is going to hospital, his operation is going on. Okay, either you have to diagnose the tissue is either it's benign or malignancy. Okay, they collect the sample. The operation time is 2 hours, 3 hours, 4 hours, like. Okay, they take the sample, immediately cutting the cycle, they put it in the dry ice. Okay, dry ice, and from operation theater to laboratory came, and instantly they cut it on this is called cholesterol. It is in -20°. Make the section. Okay, after make the section, do staining. This collection of the tissue to staining, it hardly takes 45 minutes or 1 hour. Within 1 hour, they can report it. So this kind of patients is either benign or malignant. They give the result to the doctors in the they take decision. So this is paraffin fixation of tissue, fixation, this fixation, post fixation, dehydration, then paraffin waxing. Then you have to, once it is section in the with paraffin during staining, what do? You have to make first remove the paraffin. For remove the paraffin, you remove the paraffin. Then in your slide, only section tissue is there. Right? Normally we make it hydration, then we make staining. If it is staining, then we make dehydration, then we make mounting. Okay. So my second part, everything is clearly written here. Staining normally normally tissue, it is always colorless. Tissue is always colorless. But how we can see it in microscopy? Microscopy, it is light microscopy. The basis is contrast. So normally if you took some photograph, if background is important. By only this light microscopy make the image on the basis of so the hematoxylin and using staining, it is the mostly 90% or more than 90% used for the histological purposes. Okay. So sometimes we call it clearing agent. So in paraffin is there, tissue with paraffin. Then you have to remove the paraffin. We call it clearing agent, xylene. Anyone has experience with working on xylene? Anyone? So, what about the experience with xylene, working xylene? You took xylene by pustule pipette or appendix tube or which material you to take the xylene to your from the main bottle to your experimental bottle or experimental Coughlin jar? Micropipette. 100% sure? No. Because if you put a micropipette with tips in xylene, plastic will be melt. Plastic will be melt. Always working on xylene, always use glass. Okay, xylene. So normally sometimes, yes, students. So sometimes at your home or somewhere, this birds are painting, make painting in your wall, right? You got some smell. This smell is due to xylene. The xylene smell. This smell. Okay. Xylene. So this is the staining. We call it in tissues the paraffin. We call it first. We have to remove the paraffin. We call it deparaffinized. If you put your section in xylene, 15 minutes. Okay, we call it xylene 1 and make one couplinger here, second couplinger. Initially 90% or 95% done. Then put another couplinger so that it will be 100% clear. Once you got it, then we call it rehydrate. Okay, 2-propanol, 100%, 90%, 70%, 2 minutes each. In this way, put in the water. Wash with distilled water, put in 10 to 15 minutes in the complete, okay, water. Now your slide in water. Now your slide is ready for any study, either it is histology or immunohistochemistry. Histology means simple staining. So hematoxylin used in staining protocol. Normally we put the section with we put that is two way. In coupling jar, say hematoxylin is also there. Is the put the your slide. Or what you can do, you can make extra. Okay, you can make. Normally we do. If you took in the your laboratory sink 2 iron rod, okay, in this way, put your slide here, okay, then with the dropper, just give the hematoxylin staining here and here, okay, 1, 2, 3 minutes, it depending on the tissue. After hematoxylin staining, remove the extra staining, wash it, hematoxylin, then we call it counter staining with eosin. Okay, so normally hematoxylin staining we do in minute, eosin staining we do in seconds. Okay. Okay. This one hematoxylin 10 to 60 seconds. It is the our protocol is for the pancreas. But as I told you, it depends tissue to tissue. Okay. Then until water is clear, then eosin staining 30 seconds. Okay. Then 70%, 90%, 100% alcohol. Then xylene clear. Then you section in the section, it is in slide, then make it, we have to give some mounting media. Then we give a cover slip. If you do cover slip and 4-sided, you have to seal it with nail polish. Okay, nail polish. And if you seal it, your slide will be ready. It is dry, and this kind of slide, staining slide is stable for 100 years. Room temperature. This is the beauty of histology. Staining, normally biochemical test, if you put tissue, okay, next day you get different result. After 1 month, you get different result. After 1 year, different result. But the tissue, after 1 year, 10 years, 100 years, same results. This is the beauty of histology, the beauty of staining. So this is the staining pattern. Okay, this is cover slipping. So this is some of what we did. The staining of this is the pancreas tissue. This is the hematoxylin used in staining. Okay, this is islets. So this is the hematoxylin kidney tissue. This is the control. So they see it here. Hematoxylin staining in pancreas and hematoxylin staining in kidney gives different staining pattern, and it is controlled there. It is the diabetic nephropathy. Same staining in control and necropsy give two different, so someone is taking more color, someone is not taking color due to tissue structure changed. Okay, you see left side it is histology, right side immunohistochemistry. So immunohistochemistry you need very specific antibody, you need some expertise, but histology anyone can do it. But best way, make collect the tissue, give some pathology laboratory, they'll make section, they will staining, and only staining you will make the images. Just you have to understand the images. Understanding the images it is more important. Sectioning they can do better. So if someone, so देखो histology and this is immunohistochemistry. There is a correlation immunohistochemistry. How do we find in seat here? Left side, in left side is histology. Okay, this is the pancreas. This is the islets, right? In control that. Okay, there is the caspase 3 mark. This is caspase 3. That means apoptosis. Only very few number of apoptosis. If we make astrophotosynthesis, we can see the cell here, the nucleus. You see stain nucleus, right or wrong? You seen stain nucleus or cytoplasm? I forget. Take it. Normally hematoxylin you seen normally hematoxylin. I think hematoxylin stain nucleus. Hematoxylin stain nucleus and you seen stain cytoplasm. Sometimes if you do immunohistochemistry, we do we call this what? Counter staining for nucleus. Okay, by seeing the nucleus, normally cell nucleus is round shape, mostly round shape. If it is apoptosis, its shape is disordered shape or fragmentation shape. By seeing immunohistology, you can understand either cell is apoptosis or not. And by here, and you can confirm by immunohistochemistry. But without immunohistochemistry, you can accept the result. So here, this is the pancreas. Okay, this red one is the insulin, immunohistochemistry. Green one is the glucagon. I told you one question, many answer. One question, many answer. See here in diabetes rat. So in control rat, always left side like this. Insulin inside and glucagon outside. Okay, but in the diabetic rat, this is diabetic rat. Okay, we see it here. Insulin is decreasing and glucagon is increasing, and some cell only insulin cell. So this is surprising result to us. There is surprising result to us. Then we start see it here. This is nucleus here. Okay, this is pancreas, islets. This is islets. This islets. This one, this small one, we found there is no islets. So only this one we have published one paper. That means beta cell regeneration. If beta cell destroyed everything, then some beta cell regeneration happens. So we did one experiment and get 1 by 1 free. Okay, that means we get another answer. Insulin is decreasing. It's okay, but we find some in cell with that means regeneration. Okay. So the image, these islets, insulin, glucagon, all are here. This is a beauty. Okay, this is, you see, this is the control islets. Okay, right side, diabetic. Someone, you see, sometimes this is beautiful. Okay, see it here. This is the control. This is the glycation. This is diabetic, too much glycation. Where is glycation? It is either in the kidney, which way? So one question, many answer. One question, many answer. This is the beauty of histology. Histology is preserved tissue architecture. One question, many answer. As I told you, seeing is believing. Seeing is believing. one photograph, okay, one photograph can replace 100 pages, can replace 1,000 pages. Okay, so this is my very much my expertise. So why you do histology? To see the toxicity. To see the toxicity. If you see the toxicity, normally it toxicity start on liver. On liver. So the liver structure will be by see that one is normal, another is not normal. So with this view, I think we shall take some coffee tea break. After tea break, again we join inshallah. Okay, let's. Within 10 seconds, 10 seconds only now, 8 seconds. Like this is the snapshot of a tissue. Yes, my dear friends, brothers and sisters, still you have energy? Hey, mashallah, mashallah. Very good. The art and science of immunohistochemistry. Right side, hey? This is the beauty. I like this. My expertise, Pakistan, last time in Pakistan, I established this histology, no, not histology, immunohistochemistry and immunocytochemistry. Triple channel, one single session, you can check 3 antibody A, B, C. Okay, this is the beauty. You see, so now I'll share some of my own experience. Okay, left side, this is it. We did some apoptosis model. This is the control. STG, 2 hour, 4 hour. What happens here? Okay, we found it here. That means found it some development of apoptosis model using streptozotocin. Okay, it happens by using this one. It gives similar result. So you have to do, after sectioning, you have to do microscopy, because histology without microscopy you can't do it. You have to see the slide under light microscope. So very simple. Normally microscope is nothing. What happens? Normally our naked eye cannot see the at cellular level. It just magnifies. It just magnifies. So normally in the microscope, okay, there is 2 lens. One is we call it ocular lens or eyepiece. It is always 10x. Always 10x. Okay. Always 10x. So that means if you see your species, it will be 10 times magnified, but totally wrong. Okay. It has 2 lenses. One lens here, one lens is objective. Okay. Normally lens, if you see one figure here, in the side, you get the photograph in opposite side, right? Head to tail. Then in second lens, it tail to head. That means we are giving the figure at the right direction in lens. So the magnification depends not only eyepiece, it depends on the objectives. Normally, an objectives we call it 4x, 10x, 20x, 40x, 100x, right? So that means if it is 4, using 4, 10x, 10 plus 10 into 10 into 100x. Okay. So that means it is always constant. Only here is the, if you want to the big picture, 4x, moderate picture, 10x, 20x. Okay, but if it is very focused on a single cell, 100x, 60x, normally 100x, this kind of lens need oil emulsion. Okay, this is like my microscope. We are using Nikon microscope. I am very familiar with this microscope. Okay, objectives. Okay, देखो, light microscope. If it is your object, there is a stage, right? There is a stage. If many people, if your light is from downside, make the slide opposite. If your light is upside, make it straight. Many people do mistake here. Okay, light microscope. So just sampling, it is nothing, it's just only it is magnification. One is magnification, another is the resolution. Magnification is a magnified. What is the difference between magnification and resolution? So you see in your mobile camera, there is some pixel, 10 pixel, 20 pixel, this pixel. What is the meaning of pixel? What is that? So it means if you have a small camera, camera is pixel is less, you take a photograph. If you make it bigger photograph, it will be destruction. But if it is a pixel is resolution is high, then if it is take the photograph, but if you make it big size, it will be clear. One is magnification, another is the resolution. Magnification is not the big issue. Issue is the resolution. Therefore, again, normally in the lens, objective lens, it depends on 10x, 10x, 20x. It's not the matter. Matter is that there is in every lens there is written NA, numerical aperture. Oh, here's my resolution. More NA, more the expense of the lens, more the resolution. Got it? So this is our microscope. So these are some figure, left side, right side, and okay. So this is the left side is the control rat. How beautiful figure, and this is the diabetic rat, and we got some treatment. Left side we got in the control rat, all are large eyelids. Right side, large eyelid is missing, small and medium eyelids is there. And when give the treatment, medium and large. So we measured the insulin. We found that insulin is, in case of diabetes, decreasing. Okay, insulin level is less. So insulin level is less due to less size of pancreas is okay. Size of eyelid is decreased. Then in case of treatment, insulin level is increasing. That means size of eyelids is increasing. Size of eyelid increasing means beta cell number is increasing. It make a correlation. Normally nowadays, if you want to publish papers, you need figure A, B, C, D. One study you do somewhere, and this result you have to support by other experiment. In that cases, immunohistochemistry, immunocytochemistry, histology is a better option. You can see it, how beautiful figure. Okay. Okay, you see location of the cell, apoptosis, and it's here. You see here in the right side. Okay, right side, red one is the insulin. It is the cell line, and blue is the nucleus. Okay, it is in the blue, some blue, there is no red. Here, many red. That means red one is the insulin. We found that yes, insulin secretion is going on. It's more insulin secretion, no red is there. But less insulin is there, less insulin secretion, more red will be there. This kind of information, we got it by seeing, we can understand. Okay, you see it left side and right side. Control that. This is the control that. And this is the apoptosis rat. You see here, our nucleus are well structured, round shape, and right side necrosis, sickness. By seeing this one, you can understand. But
What is this green in this like top bottom right?
okay, wait. The top one is the histology. Bottom one is the immunohistochemistry. What we did here, insulin, red one is the insulin, a blue one is the green one is the tunnel. Tunnel is a test, is a marker of apoptosis. So you see here, in the right side, in the left side, no green, no apoptosis. Right side, lots of like in nucleus, all are in green. That means here the histology result is supported by immunohistochemistry result. Histology, by seeing the cell histology is enough for primary purposes.
So this tunnel is like it tells that there is an antibody against an apoptotic protein.
Yes. It is very specific. Tunnel test is very specific, highly authentic test.
So in that nutshell, we can say that you have used two antibodies, one for insulin and one for this apoptosis.
Yes. Same time. So this is one of the study result from the University of Faisalabad. Okay, some student what he did, one of my teachers sent me some samples. Okay, send me samples. We did it. Okay, and she was surprised. She gave 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. She gives 11 sample to us. Okay, A, B, C, D, F, G, H, I, J, K. Okay, we did it. I make a comment. The group A, this one, group B, this one, this. She was so surprised. She gave only the code. But by seeing the result, one of my students did it. Okay, but data analysis, I am very much expert. Okay, by seeing within second, I can tell, okay, this happens. Okay, she was very surprised. So it is message for you. I have very clear idea regarding histology and immunohistochemistry. Very clear idea, very clear concept. Not to this level, but what is needed for you. Okay, even I told you distance doesn't matter. I can help you to establish immunohistology, cytology, this kind of laboratory. I know which materials normally is paraffin. Sometimes many things depends on raw materials. Which one is the best materials? Which is the best slide? This. I have clear idea. Yes, sir. No. You can try. I think it's impossible. It's possible.
I don't know.
I know. 3.
He's saying 3 millimeters.
3 millimeter can. Human eye can differentiate 1 millimeter. Human eye. 1 millimeter differentiate can. In the scale you find very small, it's only 1 millimeter. 1 millimeter or 3 millimeter you can do it. But 3 micrometer you can't.
3 millimeter is good for
impossible. No. 3 millimeter means 3 millimeter means a thickness. That means it is many section is there. Huh?
That's cucumber.
This is 3 millimeter and 3 micrometer. That means 1,000-fold less. So this is another study. Sometimes you can do it. It's meaningless.
Before my program, we had only 1 centimeter. So
okay, bhai, baat suno. So you can do it. It is meaningless to me. Either you have surgical, either told you. Tomorrow option to hai na. Either told you. So you have tissue. So sometimes our microtome is not working. What do we do? I went to Dow Medical of Health Sciences. They have a good pathophysiology, histology, pathology they're doing. Okay, they told me, okay, give the sample to me in 70% alcohol. or give me sample this one. You want this sample? They did all the things and make my life easier. They give section to me. Okay, collaborate. पता करो इधर मिलेगा. To collaborate in Pakistan is very easy. Okay, without doing appointment, you can go anywhere. Outside country, very difficult. बोले जो सार मुझको बचा लो. उसके साथ कुछ लिए कुछ तोहफा ले जाओ. जे अम्मी ने पकाया आपके लिए, अब्बी ने बाहर मुल्क दिया आपके लिए नहीं आया सर. Somehow manage it. ठीक है ना? You are doing experiment by yourself, 3 millimeter. If I am the reviewer, without reading anything, cut. Discard करो उसको. Rejected. Meaningless. You are giving energy, you put money. Useless. Smart. Be smart. Be smart.
I have a comment on that. I think that the take-home lesson from these slides and your expertise is, if someone is designing immunohistochemistry, he can contact you. If someone has the slides ready, he can contact doctor for interpretation. So interpretation of the slide is, you always need an experienced pathologist or expert. So this is a very good opportunity to contact Dr. Hafiz on interpreting the results of your slide. Immunohistochemistry slide interpretation is very technical, and if you have some expertise, it will help.
Thank you, sir. So histology, okay, histology, immunohistochemistry, a technician can do better than me. But the data interpretation, they can't do it. So I did the histology, okay, I did the histology, and I make the data interpretation by myself, right? Then, then I went to SIUT in Karachi. So they're doing kidney, I am doing kidney section. Kidney section, I did this, persisting this on. And I went there. Okay, the man who is data interpretation. Initially I went there, then I give my introduction. I am teacher, this on. I invite him in my laboratory. Please, we are working on it. Please come to him. Then he came to my laboratory. Okay, and then I told, okay, we're doing the one, and we're doing kidney section, this. When I went there, I invite in my lab. I did not see that to tell him, please help me. I invite in lab. I want one kidney. And he was so surprised. Well, he has never ever seen the human kidney is very big. He did sectioning a small fraction. But in rat kidney, he see the whole kidney. He was so much happy to see the whole kidney in a single slide. Okay. Human kidney and rat kidney size is different, but shape is the same. Kaju badam hai, kaju badam. Okay. So that means even I know it, I interpret the result, either I'm right or wrong. Then I go to the expert. I invite him, and he told me, okay, you this one. He said, we discuss. But discussion is more important in science. Even if you're a master, don't think you're a master. In science, you are always lifelong learner. You have to learn from your colleagues. You have to learn from your teachers. You have to learn from your students, and you have to learn from surroundings. Okay. Yeah, एक minute. So sometimes in publication, so this is the color image. Sometimes in publication for color image it takes too much money. Then in black and white you can do it. Okay. So this is the summary. So this is the summary. So rat, hold the rat, give anesthesia, dissect, collect tissue, make it collect tissue, fix it, do sectioning, do slide, then do histology. Yes, sir.
So, one is, do you have this pool of antibodies that you have used in your lab?
Yes.
So there is also another opportunity to approach you for if you need any specific antibody.
No, we are not giving any antibody.
Okay.
It will be very expensive. So if you have some collaboration with our center, okay, maybe we can. I did what I did in Sargoda teachers. Okay, it needs mutual understanding. Okay, normally I will not do anything. I will ask one student. Okay, he or she can do it. And number two, our institute. I follow the rules and regulations strictly. First, you have to write a letter to our director. If director agrees, then it come to me. I am not any person to give permission to you. I follow the rules. Institute to institute. Then it come to me. Everything should be official and legal.
If there is any collaboration.
Yes, if possible. I only do it. It's a good opportunity. We are present in the Dr. Hafiz workshop. We found this one. In this way, we need your help. You have to go to our director. Okay. Now come to the end of this one, data analysis and interpretation. Okay. So data analysis, we are doing statistics, right? How many people know statistics? Statistics. Okay. Normally, we all are statisticians. Okay. We are doing statistics every day without knowing statistics. Okay, we are doing market, right? So if you get 20% sale, you're purchasing it, right? If 20% sale, why are you purchasing? Sale 20% off, 50% off, up to 70% off. That means if it is difference is 20%, we're purchasing it. That means significant difference. 50% more significant. 70% off more significant. We are doing statistics without knowing statistics. Everybody will do statistics. Okay, boys, we're going market. Okay, so you want to buy some potatoes, aloo, baigan, bhendi can buy, na? So you're checking shop 1, shop 2, shop 3. Which one is the quality good? Which the price is good? You are doing comparison, right? It is a statistics. Yes, ladies, you are going to shops to purchase salwar suit. You are going shop 1. These. Shop 2. So for shop 1 में उसका asking price था 3,000. इधर 4,000. Shop 3. Then market 2. Okay. Then market 3. Then you are doing statistics. Okay. Shop 1 price A है. Shop 2 का price A है. Shop 3 का price A है. कपड़ा तो same लग रहा है. फर्क है. Then you are discussing with your auntie, ammi है. Then you take a decision, right? It is statistics. Every day we are doing statistics. Without doing statistics. Statistics में कुछ नहीं है. Just comparison. Just significant है कि नहीं. Okay. So yes, you see it here. So one is t-test, right? T-test, most widely t-test. Okay. So if your data is there, but it's a two group is there. Group A and group B. We use t-test, right? T-test, sometimes called sorry, so my laptop, I can write a task screen, I can write my finger. Okay, student t-test. Dekho, student is, I did graduation 30 years back. You are graduation 2 years back, right? I see laptop after my MSc. I touched laptop after my MSc. My second son, he touched laptop day 0. Okay, I have intention. So when he came hospital to home, first thing what I did, I put his hand in the laptop. Nowadays, even my mobile, I don't know many things. My son is only 7 or 8 years. Okay, so he can fix the problem better than me. कितना तेजी चल रहा है. Okay, that means students उसका तेजी चल रहा है. सारा दुनिया में है ना. Watson Crick and model, students are far better because energetic. हमारे है ना, बीबी है, बच्चा है, आलू करना है, प्याज करना है, यही है, वो है. तुम्हारे तो दिमाग ही है, तुम्हारा दिल पक्का है, ईमान सच्चा है, साफ है. Okay, so the t-test, we call it student. So someone is doing some experiment, this, and did some statistical analysis. So one student joined here and he did, sir, can you do this test in this way? He did the test, t-test. In statistics, nothing, it's mathematics. He did that means, unfortunately, he analyzes the data, but after 1 or 2 or 3 months later, in 3 months, the student disappear. At the time, 150 years back, there is no address, no telephone. He couldn't trace, the teacher couldn't trace the student. He published the paper. The first author is, he don't know the name student, he write student. So normally we write Rahman et al, Iqbal et al, right? So student et al, but student don't know. This is the study of student test. देखो स्टूडेंट कितना तेजी है, यू आर स्टूडेंट, ठीक है, याद रखना, स्टूडेंट दे कैन चेंज द वर्ल्ड, दे कैन चेंज द वर्ल्ड, वी नॉट. So t-test, two kinds. One is independent t-test, another is dependent t-test. Independence means two different groups. Another is control group, another is patient. We call it case control study. And dependent is the before and after. So some same patients, before the giving the medicine, effect of medicine, you are giving your dose after 28 days, day 0, and same subject is same. It is independent. Sorry, it is dependent. Sometimes we call it pair t-test. Pair t-test, right? Same pair, day 0, day 28. So you are a student, okay? You are a student. Before the workshop and after the workshop, if we do the comparison, it is pair t-test, okay? But if you compare this one, the before the conference, you, and before the after the conference, after this workshop, the students online and offline. This is different, independent t-test, unpaired t-test. You got clear idea? One is paired t-test, another is unpaired t-test. Sometimes we call independent and sometimes dependent. Dependent means you are dependent with day 0, initial stage. Okay. So if you have one control, one disease, t-test. But if you have 3 groups, one control group, treatment 1, dose 2, or more than 2 groups, 2, 3 group, 4 group, then t-test is not valid. Then we have to do ANOVA. Okay. ANOVA, right? ANOVA, the analysis of variance. ANOVA is nothing. It's motivation t-test. Normally, t-test you get some value, p value 0.04, right? Group 1, group 2, group 3. If you compare group 1 to group 2, and if you want group 1 to 3, you will get 0.04. Listen carefully. So p value 1, 2, 3. Group 1 to 2 and group 1 to 3. Group 1 to 3, you will get group 1 to 2 0.01, and group 1 to 3 you will get 0.04, right? 0.04. Both are significant, right? If you do t-test, you will get group 1 to 2 is significant, group 1 to 3 is significant. It called t-test. It called repetitive t-test, repetition. Same thing are doing this. Is the repetitive t-test, it gives alpha error, false positive results. So ANOVA is nothing. What you do, the 0.01 multiply n. That means how many group? 3 group. That means equal to 0.03. 0.04 multiply 3 equal to 1, 2. That means in case of, if you do a repetitive t-test, so 0.1 still in 0.3 it's significance, but 0.4 it is in t-test it is significance, its ANOVA it will be not significant. ANOVA is nothing, it's modification of t-test. What two people do? The p-value multiply n. Someone think it is too conservative. Even it is significant, it make non-significant. Then someone make it some formula n minus 1. Okay, someone 8 minus 2. In this way, there is different modification. Done it, Bonferini, this we call post hoc modification. Okay, ANOVA, if you do ANOVA, so if you do ANOVA, so group 1, 2, 3, 4. Okay, so group, देखो 1 to 2, 1 to 3, 1 to 4, 2 to 1, 2 to 3, 2 to 4, 3 to 2, 3 to 1, 3 to 4, 4 to 3, 4 to 2, 4 to 1. All kind of combination permutation. If you do this kind of experiment, this kind of ANOVA, we called it, anyone? Eh? No, it's a one-way ANOVA. We call it Bonferini test. No, ANOVA with Bonferini modification. Okay, and if you did so, if you want to do, say 1, 2, 3, 4. One is normal, 2 is the DV, and see the treatment 1, treatment 2. Okay, you want to do control only the control. What is the difference between group 2 to group 1, group 2 to group 3, group 2 to group 4? That means you make one constant group. This is called Dunnett ANOVA with Dunnett. That means you are making one group constant. One group constant. In this way, there is many statistical tools. Okay, see it here. So this is one of my publication images that said control DB and some 2 doses, 250, 500, this kind of doses. So you see red. Okay, star means it is compared. It is star is so no star is no 0. Okay, it is compared with the control. This one is compared with diabetic. Okay, that means antioxidant level in diabetic is decreased significantly compared to the control. But this okay, this glycine. So this significant, the treatment group here to here, here to here, here to here, significant level. Yes.
So this red is non-treated control and control is basically the healthy one?
Yes. Control means healthy control or DB means diabetic control. Okay, see here, one is day 1, day 43, day 1, day 43. What we did the same thing. Okay, so we compare here, all are in day 1, all diabetic are here. With the give to 43 day, so different doses give different significant. Okay, sit here, I am giving. Okay, so how you can understand? Sit here, see this figure carefully. It is very complicated. So 1, 2, 3, 4, 5, 6, 7, 8. Okay, in these cases, what we do? We add some marker. Sit here, see the black one, black line. Okay, this is the black line, right? It is A. It is B. So if the same alphabet is there, no difference. If different alphabet differ, that means B is different from A, B is different from C. This B is where from this group and this group no difference. This group to this group difference. This group to this group no difference. This group to this group difference. This group to this group difference. D and D is there, no difference. B and C is there, difference. B and B is there, difference. C and C, no difference. C and B, difference. C and A, difference. You got it? You are doing statistics, you are presenting the data. After publication, normally we are reviewer, how we can understand either it is significant or not. I'm very carefully check it. Yes, please.
Sir, here you have done multiple t-test.
No, enough.
That's the question. Different stars, I hope.
Those people do, so statistics, those people don't know anything, they do t-test. You have to do statistics. Okay. Okay. Here, sit here very carefully. Shh. Dekho, how we can understand? Age है ना? This red, right? This red. Standard. I'm picking one single. Okay. Sit here. This line. Okay. I am putting this line. Standard deviation. Standard deviation. It is significant or non-significant? देखो, very simple. ये standard deviation है ना? Make it a straight line here. If this standard deviation cross the standard deviation anyone, no difference. Okay. If standard deviation here, standard error, it is cross or not cross? Second group, the standard deviation not crossing. For safe side, देखो, इसका standard deviation right, we call it 1 SD. If you make 2 SD, that means double, right? Make it 2 SD here, right? So if you make even 2 SD, it is far from the second group SD. If you make 2 SD, इसका भी 2 SD करो. 1 SD, 2 SD, right? If you make 1 SD double, second group 2 SD, if it is not cross, significant. It is cross, may not, or may not. They have to do statistics. At least you can get idea. Okay. So my student do statistics, I write figure. By seeing the figure, I wrote p value. This. People, student do statistics. This. They do. They find exactly my value, almost 90%. Okay. So I have an eye to develop. It's developed not only single day, long day. So I was working on diabetes research hospital in Bangladesh. So I did blood glucose test, right? Blood glucose test, this test. Once my madam, he told me what is the result. He said, I have to do it by calculating this one. She told me, calculation karna jarur hai. So he have to give some result. Okay. So we are running standard, right? Standard 1, 2, 3, 4, 5, 6, 7, 8. So your sample, observance, and some standard sample very close. Jarur ki hai. If it is your observance of your sample very similar to the observance of 100, it's 100. Hey, but idea, you got idea 100, maybe it's a little bit, maybe it's 110. Idea is non-diabetic. So this develop with passage of time with discussion. Okay. So you know him? He is diabetic patients. You know? He's taking insulin, but he's very smart, very smart, very smart. So it is figure with photograph with me. So once we're traveling together somewhere, okay. So I'm talking. I had within 1 minute, okay. My wife with him, they are discussing so that they are well known to each other long time. कितने smart है? 1 मिनट में मेरी बीबी को भाग लिया. Be smart. For few times. So anyway, even he is not my model. My model is this 2%. Okay. Professor Akhtar Rahman and Professor Iqbal Chaudhary. Okay. So Professor Akhtar Rahman is the first chairman of ACC and is the former coordinator general of comstech, and Professor Iqbal Chaudhary. I'm grateful to them. I learned many things from both of them. I worked them. I came in Karachi for 6 months. I came in Karachi with a special invitation. My boss sent it here only for 6 months. 6 months. But So Dr. Iqbal Chaudhary, don't let me go home. I was stay with him 13 years with lot of love, affection, empathy, sympathy. I like teaching. I like students. Either it is my hometown or anywhere in the country. To me, it's same. And I like diversity environment. So if I come in Karachi, I learn something. If I go Karachi, I learn something. My people, I can understand their knowledge. I can understand their pathology. I can understand their ethics. I learn their hospitality, their behavior. Okay, these two persons, A, B, C, model. This is my model. A means Atul Rahman, C means Dr. Chaudhary Mohammad Iqbal, B, all of there. I found one thing. Sometimes we become very much angry, this. These two persons, I never, 13 years I work with them. They're always in good mood. Right? Everybody went to them to complain this, and bad mood, sad mood. When they come out from their room, all are happy. Very interesting thing. Okay, so try to do that. Be happy, make people happy. Okay? They are my model. So with this, I conclude my workshop. Thank you very much for joining. Okay. 25 participants. Okay. So online students, thank you for joining. It's a good time for you. Good time for me as well as I spent times. I share my experience and expertise with you. Hope you enjoy my workshop. I tried. I didn't follow the standard protocol. I try to make my expertise in lively way. Sometimes I give some example. Okay, don't take it otherwise. Don't take it otherwise, please. Sometimes we have to make lovely class. We have to give many things. So don't take it otherwise. Class is class. Example is example. Model are model. Rat is not rat. A rat is not a mouse. A mouse is not a human. All model are already model. Okay, so if my lecture will inspire at least 0.01%, at least if motivate only 1%, that's my achievement. Okay, so students, my friends, my dear brothers and sisters, so we have to do something for our family, for our country, and most importantly, to transfer our knowledge to our society for the betterment of Muslim Ummah. As I told you during COVID, give it lesson. That means even if you have money, you cannot purchase the medicine. Even so, a few days, 2 or 3 days back, there's the accident of Iranian president. Even if you're purchasing their instrument, control is not in your hand, control is in their hand. In Facebook, you're posting there. Okay, everybody goes to them. All the recorded, not with you, with them. They use it in the right time against you. Therefore, don't share everything. Okay, don't share everything. Okay, so to learn how to talk, it takes 3 years. And how to talk, when you stop to talk, it takes whole life. So my suggestion is talk less, work more. Be smart, not your clothes, not your Facebook, not your face. Be smart on your education. Be careful on your book, not on your Facebook. Right? So you have a lot of responsibility for your society, for your parents, okay, for your student, for this part. Okay, you can do anything. You can do betterment for the society, for Pakistan, for Muslim Ummah. Hope comstech will play an important role. So as I told you, it's teamwork. Okay? Reader of the leader. Read more for the betterment of you, for the betterment of the society, for the betterment of Muslim Ummah. Thank you very much. Thank you very much.